Joint pain isn't new, but as Singapore's population ages, joint pain and stiffness that's associated with menopause will become more common. A recent study found arthralgia to be the top symptom of menopause here in Singapore. Now, arthralgia is muscular and joint pain. It's a condition that affects the spine, nerves, as well as daily functioning.
To understand this condition better, we have with us Professor Yong Eu Long. He's emeritus consultant at the Department of Obstetrics and Gynaecology at NUH, and Amy Fang, who suffers from arthralgia. Professor, let's start with you. Dawn just mentioned muscular and joint pain, but Madam Fang was saying it's like being hit by a truck on a daily basis. So it's very different from just ordinary, I suppose, quotidian joint pain. How do you know it's arthralgia? How does it present itself?
Yes, this is a very valid question, and we asked the same questions ourselves a few years back. So we decided to look at all the women and gave them a form at around menopause and say, what are the problems affecting you? The common symptoms are hot flushes, vaginal dryness, poor sleep, anxiety, and joint pain. And guess what? In our Singapore population, joint pain came out number one, right? Almost a third of the women have moderate, severe, or very severe joint pains.
Yeah.
So that is a big surprise to us because it's different from the West. The West have hot flushes and vasomotor symptoms as the number one, and joint pain is number 5. Therefore, vasomotor symptoms are pretty well studied. There are many seminars, many papers, but joint pain, hardly any. So we decided to look at it in greater depth. And that was our second paper, just came out in December. And it was very interesting because it's associated with menopausal symptoms like vaginal dryness, also with muscular weakness.
As well.
So we were thinking that it's due to lack of estrogen. That's not commonly known, not among our population, not among even the medical professionals. So, but there has been evidence going on, and we have a very good human model. You were talking about cancer just now. Actually, in women with breast cancer, they have to take a drug to lower estrogens, because everybody knows estrogen drives breast cancer. And when they lower the estrogen with this drug, guess what? They have this joint pain, which exactly mimics what we find in our healthy menopausal women.
Right.
So, and when they stop this drug for their breast cancer therapy, because they cannot tolerate the joint pain disappears in those cancer women.
So there seems to be a link there, or some type of a link. Madam Fang, let's bring you in on the conversation now. You did mention to us that earlier that the pain was very severe. Can you tell us something about your journey with your diagnosis for arthralgia?
Well, first it was given to me as, this is aging, so take it. There is no other things that you can do. Then though nobody actually told me that it could possibly be linked with the menopause that I've been going through 10 years ago. So all the treatment that I have received is basically just to treat the symptom without really knowing the root cause. Until we actually participated in this program, then the awareness becomes a little bit more known to us. But still, it was just a very difficult journey because no one actually understood the pain that we have to go through.
Yeah.
Right, Professor, now you mentioned the link with estrogen levels.
Yes.
So is it simplistic to say, therefore, the test for whether you have arthralgia is the level of estrogen you have, and therefore, again, a very simplistic assumption, to fix this, would estrogen be the way to fix this?
That is, again, a very good link. And we have some evidence, but the evidence is not very definite because the study to properly understand this problem has not been done yet, which we hope to do. We are planning it. But, in the famous Women's Health Initiative study for menopausal hormone therapy, they did have asked a question about joint pain. So those on hormone therapy, estrogen therapy, the joint pains improved. And when they stopped the hormone therapy, the joint pains came back. So that's one line of evidence. There's also animal studies, Animal studies show that estrogen is important for collagen, for muscle. And for fluid, you see, if you are menopause, your skin dries up, and in the fluid around the joints similarly shrink. And I think the cartilage will rub against each other. Without the proper muscle, because it's also weakens with menopause, the joints rub against each other and cause pain. And some people have very debilitating pain on the fingers, some like Amy on the back, shoulders, knees, joints that are commonly used. And sometimes it's so bad that, recently we read about a lady who couldn't ride her motorcycle anymore because she cannot keep the clutch.
The grip. Because
during
it's so
the traffic light stop.
Yeah.
And I have some women who complain that they cannot even dress themselves because they cannot unbutton the back, the arms cannot do that.
Right.
Or women who can do, exercises.
Well, that happens with frozen shoulder as well, with many different kinds of joint pains that women might sort of see a doctor about. Yeah. But specifically with arthralgia, you were saying before, and as Wesu was pointing out, there may be this link, but it's a suggested link between the amount of estrogen and menopause and joint pain, right? Yeah. So how do you then, what are the typical ways of treating the severity of this pain with arthralgia?
Yes. I think, first of all, we don't want our women to be dismissed. If this complaint comes up, joint pain, right, and associated with vaginal dryness, associated with muscle weakness, I think the family should understand this is real and this is affecting, because sometimes it's just brushed off, and I've heard of some women having to suffer in silence, cry in the toilet, because they don't upset the families. I mean, these are very strong women, capable, and one day they have this pain, they can't sleep. And when they can't sleep, the brain doesn't function properly, brain fog, And then the children wonder, Mom, what's wrong? You changed. And one thing leads to another, and there's a lot of family tension. So the understanding, the awareness is so important. Amy, what do you think? We were talking about that as well.
It was just like a sudden change to another person. And the family is just like, why are you dropping plates? Why can't you even hold a plate? Oh, you just slip it off. So without the proper education and awareness to the family, it is just not helping the situation.
So not being dismissed is a very big part of feeling better, but part of feeling better is also getting that root cause actually addressed.
Yes, absolutely.
Have you seen that happen for yourself yet? Final question.
No. Not yet. So what I do is I've just started to...
But you said you had some exercises.
Yes, so I started to have some gym training for about 2 years, and it did help, because my muscles are a lot stronger now, and I can hold myself better.
That's just overall getting healthier and physically more able, not actually addressing this particular problem.
But I think muscle, because when we did our study, the joint pains associated with weak muscle. So I think muscle has a lot to do with it, because it protects the joints. So it's a bit counterintuitive. If you have backache, you don't want to strain your back by lifting weights, but you need to.
You have to start
supervise, proper, so that it doesn't injure the injury, make it worse, but strengthen the muscles to protect the joints. So there's a difference, And our physios are very good at teaching this. And actually, we are planning a study to see whether hormones and exercise alone and in combination can help the situation. So hopefully they can then restore people like Amy to the confident women in command of the situation with good quality of life that they deserve, actually.
Regular exercise, very important for everyone. I fully advocate that. Thank you so much for coming into the studios to talk about this very important subject. Professor Yong Eu Long there from NUH and Madam Amy Fang. Thank you.
Thank you.